Good afternoon, everyone. The title of my paper is Analysis of Specular Microscopy, Pre- and Post-Corneal Collagen Cross-Linking in Patients of Keratoconus with Thin Corneas. The purpose was to evaluate the corneal endothelial changes following CXL for the treatment of keratoconus in patients having corneal thickness between 400 and 430 micrometers. It was a prospective non-randomized clinical study with a sample size of 32 eyes. The study population was patients with keratoconus having minimum corneal thickness between 400 to 430 micrometers undergoing standard CXL by the Dresden's protocol. Patients having corneal scar pachymetry values less than 400 micrometers and more than 430 micrometers, history of recurrent erosions, connective tissue disorders, or previous history of viral keratitis were excluded from the study. Specular microscopy was performed pre and post CXL to assess the endothelial cell density, the coefficient of variation, and the percentage of hexagonal cells. Follow-up was done on day 5, 20, 45, day 60, and day 180. Specular microscopy was done in each visit. Coming to the results, the baseline endothelial cell density was 2908, which exhibited a decline following CXL. The 6 months follow-up value was 2847 with a mean difference of 60 cells per millimeter square. We can see the comparison of endothelial cell density across the different time points. The mean baseline coefficient of variation was 28.69. It exhibited an increase following CXL, and we can see the comparison of coefficient of variation across the different time points. The baseline percentage of hexagonal cells was 58.22 plus minus 5.99 percentage. In this figure, we can see the comparison of percentage of hexagonal cells across the different time points as it exhibited a decline following CXL. In my study, the endothelial cell density exhibited a decline, the coefficient of variation increased, and the percentage of hexagonality decreased at the end of 6 months period. However, no harmful endothelial reactions were noted in our study. A study was conducted by Rao et al., which showed that the average endothelial cell density in the Indian population in the age group of 20 to 30 years was 2782. The recorded values in our study fell within this physiological range. Similar studies were conducted by Vinciguerra P. et al., Quinones G.D. et al., and Goldich Y. et al., which showed a 4.9, 3.6, and 7.5% decline in the endothelial cell density post-standard CXL. In our study, there was a 2.09% decline in the endothelial cell density. A study was conducted by Gues et al., which showed that the mean endothelial cell density decreased till 6 months following CXL, and thereafter it stabilized. A study was conducted by Badavi et al., which showed that at the end of 3 months period, there was a 6.7% decline in the endothelial cell density, which gradually improved, and at the end of the 12 months period, it increased towards the preoperative values. In our study, the endothelial cell density exhibited a decline over a duration of 6 months. Nevertheless, we anticipate that the endothelial cell density will continue to stabilize with regards to the results of the studies mentioned above. Goebbels et al. Did a study which showed that more severe the stage of keratoconus, lower will be the endothelial cell count and higher will be the coefficient of variation. In our study, the reduction in the endothelial cell density may be influenced by other factors as well, such as the physiological effects of aging and the pathological implication of the disease on the endothelial cells. Further long-term trials are warranted given the possible significance of the procedure's current effect on the corneal endothelium. The clinical implication is that specular microscopy should be done routinely in keratoconus patients having minimum corneal thickness between 400 to 430 micrometers prior to them undergoing standard CXL. Patients undergoing standard CXL should also be put on long-term follow-up post-standard CXL. To conclude, my study recorded a decline in endothelial cell density, increase in coefficient of variation, and a decline in percentage of hexagonality in keratoconus patients till a 6 months period after standard CXL. These are my references. Thank you.
Is this study adding to the newer knowledge, like, because this is all that we had been knowing? We are doing a specular microscopy after all CXLs, and similar to what the previous studies are saying, CXL, if done in a proper residence protocol, it doesn't cause any endothelial cell loss, or it doesn't cause any endothelial loss as such. So how your study is adding to our knowledge?
So in the studies which were conducted previously, the decline was noted in the endothelial cell density, but it was not statistically significant. In my study, it is statistically significant. And in many places, specular microscopy is not conducted routinely in patients who are about to undergo standard CXL. After this study, even those hospitals can incorporate this into their policy and start conducting specular microscopy and keep these patients on a close long-term follow-up.
Ideally, specular microscopy has to be done before we are undertaking any sort of a CXL. If it's not done at some places, that might not be the right idea. Okay, your study, like, it goes in tandem with what the previous studies have shown.
Yes, sir.
Yeah, thank you.